డాక్టర్ రేఖా యానీ ప్రసాద్ గారు ఆస్ట్రేలియాలోని మౌంట్ సైనాయ్ వర్చువల్ హాస్పిటల్లో ఎండి మరియు సిఇఓగా విధులు నిర్వహిస్తున్నారు. గత 18 సంవత్సరాలుగా ఆస్ట్రేలియాలో క్లినీషియన్గా అలాగే కన్సల్టెంట్ ఫిజిషియన్గా డాక్టర్ రేఖ విధులు నిర్వహిస్తున్నారు. ఈరోజు మనతో పాటు ఉన్నారు డాక్టర్ రేఖా ప్రసాద్. డాక్టర్ రేఖా ప్రసాద్ గారు, ఇప్పుడు మనం అధిక రక్తపోటు గురించి మాట్లాడుకుందాం. అంటే హైపర్ టెన్షన్ అంటారు, అధిక రక్తపోటు అంటారు. ఇది కూడా నేడు ఎక్కువగా చూస్తున్న సమస్య, చాలా ఎక్కువగా ప్రపంచవ్యాప్తంగా. డయాబెటీసు, ఇంతకుముందు మీరు మాట్లాడిన డయాబెటీసు లేదంటే మధుమేహ వ్యాధి, అలాగే అధిక రక్తపోటు, ఇవన్నీ నేడు అత్యధికంగా చూస్తున్న ఆరోగ్య సమస్యలు. అధిక రక్తపోటు అనే విషయానికి వస్తే, అధిక రక్తపోటు గురించి లేదా హైపర్ టెన్షన్ గురించి మనం ఎప్పుడు ఆందోళన చెందాలి? దీని ప్రభావం శరీరం మీద ఎలా ఉంటుంది?
One of the components of the metabolic syndrome, which is again a painless disease, people don't recognize that they've got hypertension unless you go and get yourself checked. There are lots of symptoms and signs that we can pick up if we have got hypertension. For example, people do start to have headaches, do start to have palpitations, and some of them feel quite tired, and some of them also faint and pass out. So these are the few symptoms about having hypertension. Again, the hypertension, we've identified all these things as symptoms. Please go and get yourself checked by your GP, or nowadays you can get the blood pressure monitor available in the pharmacy. You can have it at home and check. It's so interconnected with the other things that we take it for granted, especially stress and the amount of sleep that we have. It's also connected to obstructive sleep apnea, lack of sleep. This can also cause hypertension. And then there is a very small segment of population who can have hormonal dysregulation syndrome that can cause the blood pressure to go up. But all these things need to be first recognized. The key to hypertension is when you have all these symptoms, go get yourself checked or have the machine at home and check. And if it is high, go and see your doctor, get yourself tested, and the doctors can appropriately direct you whether this hypertension is because of the stress, or because of obesity, or because of sleep disorder, or is it intrinsic? That means, is it because of your internal problems, because of your hormonal dysfunction? Your physician would be able to direct it.
అధిక రక్తపోటు అని మీరు ఎటువంటి విషయాలను చూసి దాన్ని అధిక రక్తపోటుగా నిర్ధారిస్తారు?
This is quite an interesting question, because we doctors also face the same diagnosing somebody with hypertension. When do we actually call someone having hypertensive episode or hypertension per se? So that's why it's very important for you to have the blood pressure checked when you are at home, not in the hospital setting, or not when you're sitting with a nurse or a doctor. Because when you go into the hospital setting, what we call it as white coat hypertension is quite a common phenomenon. People get stressed out just walking into the hospital or walking to see the doctor. People get stressed out and they start having all the symptoms that I've described. And if you've got consistently 3 recordings of more than 135 or 140, again it depends upon the age group, of systolic and diastolic about more than 80, you have to go and see your doctor.
డాక్టర్ రేఖా ప్రసాద్ గారు, అధిక రక్తపోటు అని ఒక సామాన్య ఒక మనిషి నాలాంటి వాళ్ళు తెలుసుకోవాలంటే ఎటువంటి లక్షణాలను మనం గమనించాల్సి ఉంటుంది?
Hypertension symptoms are quite non-specific. It can start from simple headache to a very, very severe pounding headache, and also it can involve feeling just fatigued, palpitations, and sweating. And the extreme other end of the symptom might be the first time you might have a chest pain or heart attack, could be in the context of having very high blood pressure or hypertension.
డాక్టర్ రేఖ గారు అధిక రక్తపోటు లక్షణాల గురించి చెప్పారు. ఏవైనా ఇతర వ్యాధుల లక్షణాలు కూడా అధిక రక్తపోటు లక్షణాలని అనుకరించే అవకాశం ఉందా?
It's such a non-specific symptoms, and as you rightly said, thyroid problems, stress, and stress is a part of everybody's life right now, and most of us will have the palpitations or headache. It's such a normal kind of presentation. People might think, oh, this is migraine, or it is my thyroid problem that is playing up. What we need to emphasize is these are those small little symptoms that might end up being a big issue if you do not go and get a thorough checkup done by a doctor.
డాక్టర్ గారు అధిక రక్తపోటుతో బాధపడుతున్నవారు మందులు సరిగా వేసుకోకుండా లేదంటే సరైన జాగ్రత్తలు తీసుకోకపోతే ఎటువంటి ప్రమాదం సంభవించే అవకాశం ఉంటుంది?
So hypertension is what I call it as a fire in the engine, and what you see is the exhaust of the car. When you see that, there are lots of side effects of the silent killer. The commonest one is heart attacks, and people end up having dead by having unrecognized high blood pressure. Second commonest presentation is the strokes. Young people around you see people having strokes. The third thing is this can slowly affect your kidneys. We've got very common scenario out there in India, people having chronic kidney disease and leading to dialysis. One of the drivers for this is unaddressed or untreated hypertension.
అధిక రక్తపోటు బారిన పడకుండా ముందస్తుగా మనం ఎట్లాంటి జాగ్రత్తలు తీసుకోవచ్చు?
Again, coming back to addressing the lifestyle changes, because these are all connected with lifestyle, and what I can suggest is have some strategies for dealing with stress. Have a counselor, talk to someone. You don't need to go to a paid counselor. Have a good friend, have your local doctor or a GP who you can sit down and talk about your stresses, talk about what's driving. And some of the people say, oh, I'm not overweight and still I've got high blood pressure, and that's a time when you have to go and speak to your GP or your doctors or a physician to address if there is anything else that is driving, as we spoke about the screening test and everything. Ultimately, it comes down to lifestyle changes, good eating habits, smoking, alcohol we didn't touch, but alcohol is also a big driver for hypertension, and good sleep.
డాక్టర్ రేఖా ప్రసాద్ గారు చెప్పినట్టు అధిక రక్తపోటుని ముందస్తుగా గుర్తించడం చాలా ముఖ్యం. లక్షణాలు కొన్ని తేలికపాటి లక్షణాలు ఉండొచ్చు, ఒక్కొక్కసారి గుండెపోటు, స్ట్రోక్ ఇలాంటి తీవ్రమైన లక్షణాలు కూడా అధిక రక్తపోటు వెనకాల ఉండొచ్చు. సాధారణ లక్షణాలను కనుక చూస్తే విపరీతమైన తలనొప్పి రావడం, అకారణంగా ఎప్పుడు తలనొప్పి వస్తూ ఉంటే అది అధిక రక్తపోటుకి ఒక లక్షణం కావచ్చు. గుండె ఎక్కువ వేగంగా కొట్టుకుంటున్నట్టు, దాన్ని మనం పాల్పిటేషన్స్ అంటాం. బాగా చెమటలు పోస్తున్నా, ఛాతీలో బాగా అసౌకర్యంగా పట్టేసినట్టు అనిపించిన, ఇవన్నీ కూడా అధిక రక్తపోటు లక్షణాలుగా భావించాలి. కాబట్టి అధిక రక్తపోటుని ముందస్తుగానే లక్షణాలని గుర్తించి మీరు కనుక చికిత్స తీసుకుంటే రక్తపోటుని నియంత్రణలో ఉంచుకోవచ్చు. డాక్టర్ రేఖా ప్రసాద్ గారు, మధుమేహం గురించి మనం ఎప్పుడు ఆందోళన చెందాలి? ఈ వ్యాధి యొక్క ప్రభావం శరీరం మీద ఎలా ఉంటుంది?
Diabetes is something which is called as like a silent killer because it can affect the hair to the toes of people's body. We don't actually recognize that till we get the end stage of those problems, like for example strokes, toe ulceration and amputation, dialysis and strokes. So it's very important for us to recognize at the early stage to prevent all these things.
ఒక వ్యక్తికి మధుమేహం ఉంది అని తెలుసుకోవాలంటే ఎలాంటి లక్షణాలు ఉంటాయి?
Because lots of people talk about diabetes and lots of doctors talk about diabetes, but for a common man, how do we recognize those signs, aspects of one's health that can be an effect on diabetes? Sometimes simple people will say that I'm feeling excessively tired, I'm having lots of urination problems, lots of even infection, lots of UTIs, that's urinary tract infection, mouth infections, ulcerations, and losing weight or increased hunger, and even fainting and passing out. These could be the early signs of diabetes, and this is when these have to be taken seriously and go and see your doctor to get these things checked.
మధుమేహం ఒకసారి మొదలైతే వీటి గురించి జీవితాంతం మందులు వాడాల్సి వస్తుందా?
Lots of my patients ask this one, oh, I'm a borderline diabetes person, I don't want to be taking medications, because at the end of the day I don't want to be on lifelong medications. This is a very, very wrong misconception, because it's like an iceberg. It slowly starts to build inside the sea level, and when it comes to the tip of the sea, what you see is just the tip, but you have to acknowledge that there is a big mass building up. When you see the tip of the iceberg, that means the end effects of diabetes has already taken place. So when you intervene at the beginning with lifestyle modifications, what we say, and I know everyone talks about it, it's not easy, but we need to start building up those small little incremental changes in terms of diet, exercise, controlling how much you eat. Some people say, oh, I don't eat any sugar, I don't eat any of the sweet stuff because I don't want to have diabetes. But at the end of the day, diabetes is not all about sweet, it's about the carbohydrates and the quantity. If you have a lot of these things, even if you might be having a healthy diet, it's not going to change. I think small little increments, small portions are the key things to prevent the full-blown diabetes, because that is the most important thing that we need to recognize.
ఇందాక నేను అడిగినట్టు మందుల విషయానికి వచ్చేసరికి చాలామంది అశ్రద్ధ చేస్తూ ఉంటారు. ఒకసారి మధుమేహం మొదలైంది అంటే వైద్యులు చెప్పిన మందులని వాడటానికి వాళ్ళు అశ్రద్ధ చూపిస్తూ ఉంటారు. అలా వాడని పక్షంలో వాళ్ళ డయాబెటీస్ లెవెల్స్ ఇంక్రీజ్ అయ్యే అవకాశం ఉందా?
Actually start to do intervention at the earlier stages. Sometimes I've seen in my practice people come off the medications. If they lose weight, if they change their diet, for example, reduce the carbohydrate levels significantly, have more of proteins, more of an exercise, you actually don't need to be on medications for lifelong. But again, there are different kinds of diabetes, type 1 and type 2. If you're type 1, you would be needing insulin, but always go and speak to your doctor and recognize that which kind of diabetes you have. That is why it's very important to have a disciplined life. How much you eat and the exercise, the quantity that you eat, you can actually prevent that from becoming a full-blown diabetic, prevent the complications of diabetes, what we say, and we can actually say to one stage that we can come off the medications. So the gist is, take the medications at the earlier stage, make the lifestyle changes. Even if you have said that you've got borderline diabetes, it's like a warning sign. Before you jump the red light signal, that's a yellow light. This is to warn everyone that if you don't change your lifestyle, if you don't change your diet, if you don't change the way you live, it's going to come into that red zone where the diabetes is full blown, and sometimes it is really hard to change all the damage that has done, which has been long standing.
మధుమేహం స్థాయిలు హెచ్చు తగ్గులు ఉంటాయి. అంటే ఒక్కొక్కసారి బాగా పెరిగిపోతూ ఉంటాయి, ఒక్కొక్కసారి తగ్గుతూ ఉంటాయి. ఏ లక్షణాలను బట్టి అది హెచ్చింది లేదంటే తగ్గింది అని మనం తెలుసుకోవచ్చు? వెంటనే ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
Most of the diabetic patients do not understand when they have got a problem, because the symptoms are not well understood by the patient themselves. Simple things. When somebody starts to have more of thirst, they're drinking a lot of fluid, then passing a lot of water, that means urination, go and check yourself, because that could be another sign that the blood sugar might be very high. And the another sign, people are having excessive sweating, palpitation, and sometimes people just feel uneasy. They feel like nauseous or vomiting. This could be another sign that their blood sugars are varying. So it's always important to check the blood sugars, and it's quite handy to have a small little blood sugar machine with you, so that you are in charge of your medications. You are in charge of your health in general.
డాక్టర్ గారు, మధుమేహం వచ్చే అవకాశం ఉన్నవాళ్ళు, ఉదాహరణకి కుటుంబంలో అప్పటికే మధుమేహం ఉన్న తల్లిదండ్రులు ఉన్నా, లేదంటే రక్త సంబంధికుల్లో మధుమేహం ఉన్నప్పటికీ అటువంటి వారు ముందస్తుగా ఎటువంటి పరీక్షలు చేయించుకోవడం ద్వారా, లేదంటే ఎటువంటి జాగ్రత్తలు తీసుకోవడం ద్వారా మధుమేహం రాకుండా జాగ్రత్త పడవచ్చు?
We from the Indian subcontinent have got such high risk of diabetes because we have got the genetic predisposition of diabetes. Predominantly that's because of our food and our calorie intake. So when you have a strong family history of diabetes, the most important thing is to screen for diabetes. There are lots of number of screening tests that are available with your local doctors. You can go and speak to them and see if they can do some blood tests. The commonest one is HbA1c, which can give us the control of diabetes for the next or the last 3 months and give us a fair bit of a range of where you stand in terms of the chances of having diabetes. Lots of our population does not do the recommended exercise of 45 minutes of walk per day, and lots of other risk factors like smoking is quite rampant in and around our population. Some people, they don't smoke, but there is the exposure of passive smoking, and also the food habits that we eat is like high calorie rich, more than our required amount of calories we eat. So all these things accumulate and we are put into that category of high risk of diabetes. So the most important thing is recognizing the signs, going and getting regular checkups done, picking up the early signs, engaging with your doctors, change in the food habits, cut down your carbohydrates, cut more of protein intake. Again, vegetarians have got the other choices of proteins and non-vegetarians have got the other choices of proteins. More of exercise, more of being active, taking your health seriously. I think that's the most important thing.
మధుమేహాన్ని నియంత్రించాలంటే, అంటే రాకుండా, అసలు ముందస్తుగా రాకుండానే మనం జాగ్రత్త పడాలంటే ప్రతి ఒక్కరూ ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
When you have a strong family history of diabetes, the most important thing is check. Sometimes when you see people that I'm not overweight, so I cannot get diabetes, that's again a myth. People who have got very strong family history of diabetes are still chances of having diabetes, so they have to check as well.
డాక్టర్ రేఖా ప్రసాద్ గారు చెప్పినట్టు మధుమేహం రిస్క్ ఉన్నవారు, అంటే మధుమేహం వచ్చే అవకాశం ఉన్నవారు, లేదంటే ఊబకాయలు అంటే అధిక బరువు ఉన్నవారు కూడా, అలాగే మధుమేహంతో అప్పటికే బాధపడుతున్నవారు, వీరందరూ కూడా తగు జాగ్రత్తలు తీసుకుని ఆహార విషయంలో, అలాగే వ్యాయామం చేస్తూ, మందులను క్రమం తప్పకుండా తీసుకుంటూ, ఒకవేళ ఇన్సులిన్ అవసరమైతే అది కూడా తప్పకుండా తీసుకుంటూ జాగ్రత్తలు వహిస్తే మధుమేహాన్ని నియంత్రణలో ఉంచవచ్చు. డాక్టర్ రేఖా ప్రసాద్ గారితో ఇప్పుడు మనం స్ట్రోక్ గురించి తెలుసుకుందాం. డాక్టర్ రేఖ గారు, స్ట్రోక్ కూడా నేడు ఎక్కువగా చూస్తున్నాం. అది యుక్త వయసు కానివ్వండి, అధిక రక్తపోటు ఉన్న వారిలో కానివ్వండి, స్ట్రోక్ అవకాశాలు ఎక్కువగా ఉన్నాయి, లేదంటే స్ట్రోక్ వచ్చే అవకాశాలు మనలో ఎంత ఉన్నాయి అని తెలుసుకోవడానికి ఏమైనా లక్షణాలు ఉంటాయా?
Thank you for asking this question because this is something which is so important. Stroke again can present in lots of ways. Like for example, people having just tingling in their hands or fingers, or having visual difficulties like blurring, or suddenly people having double vision. The other symptoms are not able to talk or get the right words. Could be the early signs, and sometimes people just say, I'm feeling heavy in my arms and just not feeling right. These are the early signs that we need to recognize as strokes, because if you ignore these, people end up having a big stroke or a major stroke, which could end up actually making half of their part of the body immobilized, not able to talk or not able to see or just be bedbound. So it's very important for us to recognize that there are small little, what I call it as sparks before the fire. So recognize those things and intervene.
స్ట్రోక్ వచ్చే అవకాశాలు ఎవరిలో ఎక్కువగా ఉన్నాయంటారు?
So again, stroke happens in the same group of people that we spoke about: diabetic, hypertensive patients, and also you might see people who are smoking and alcoholics, and people who have got some rare blood conditions, which is not a major problem, but there are few possibilities that younger people do have strokes, what we call it as blood disorders.
ఒకసారి స్ట్రోక్ వస్తే వాటిల్లో మినీ అండ్ మేజర్ స్ట్రోక్స్ అంటూ ఉంటారు, వీటికి వ్యత్యాసం ఏంటంటారు?
This is again very important for us to educate people or recognize that there are incidences where we have a mini stroke or TIAs, which we call as, where the patient has or the people have signals of just numbness and not feeling right, not able to talk, and after half an hour they feel better and they feel, oh, there's nothing wrong with me, and then they go on with their everyday life. These are mini strokes, because if you don't address that and go and get yourself checked, these are 4 warning signs of a bigger flood to come. It's like there is a tsunami going to come, and you should actually heed to these small warnings.
డాక్టర్ రేఖ గారు, ఇప్పుడు మీరు మినీ స్ట్రోక్ గురించి చెప్పారు. అంటే అది వచ్చినట్టే వచ్చి ఆ వ్యక్తికి తెలియకుండానే మళ్ళీ వాళ్ళు సాధారణంగా వాళ్ళ పనులు వాళ్ళు చేసుకునే పరిస్థితి. ఇలాంటి మినీ స్ట్రోక్స్ పెద్ద స్ట్రోక్స్ వచ్చే అవకాశానికి దారి తీయవచ్చా? అలా జరగకుండా ఉండాలంటే ఎలాంటి జాగ్రత్తలు తీసుకోవాలి?
This is very important, because actually we have got few tests that we can do to prevent a major stroke. What we call is a stroke workup. The question that we need to ask is, why did we have the stroke, and what can we do to prevent the stroke? So the stroke happens in 2 mechanisms. One is when people have the palpitations, when they feel that their heart is beating quite fastly or irregularly. They've got a problem with their heart, where the heart tends to form clots in the heart, and these clots put the person at high risk of having a stroke. So that's why it's important, when somebody has got these funny feelings or numbness or having problems with speech, finding difficulty or speech or blindness or double vision, even for a short period of time, what I would suggest is go and speak to your doctor and say to that person or doctor, saying that, you know, I've got a problem which was quite transient, and now I'm fine. I need to know why has this happened. So the investigations that the physicians can organize is an echo, an ECG. In an ECG we can pick up an arrhythmia. That means the commonest cause of the stroke is atrial fibrillation. That means the top chamber of your heart goes at a very fast rate, and this puts at a higher risk of forming clots in the heart. And when the clots are formed in the heart, they go into different part of your circulation. When this clot goes to your brain, you have this half, you know, people say paralysis, end up being bedbound. So when the clot goes and tends to go into the brain circulation, we end up having the stroke. We can prevent this from happening. When you discuss it with the physician, there are blood thinning agents we can give for the dissolving of the clots. So this is something which we can do at the beginning of the mini stroke and prevent a major stroke. Discuss with your doctor about the second investigations are what we call it as the CT scan of the heart, which is called as CTCA, CT coronary angiogram, to see if there is more of plaque formation, and you can address that by doing more specific investigation. I'm not going to go in detail. You can go and speak to your physician about it.
డాక్టర్ రేఖ గారు, అసలు స్ట్రోక్ అంటే ఏంటి, అది ఎలా వస్తుంది?
Stroke ante the simplest explanation is there are 2 mechanisms of stroke. One is a clot formation and the other one is a bleed in the brain. So bleed in the brain is usually because of the high blood pressure or uncontrolled blood pressure. Or the third thing is, which is much more rarer, is the aneurysm. There are some malformation of the blood vessels in the brain that they rupture, again in the context of having high blood pressure. The other mechanism, which is much more common, is a clot. What we call it is an ischemic stroke. This clot formation starts usually in the top chamber of your heart. So when the heart goes into irregular heartbeat, it becomes like a curd in the top chamber. It coagulates and it becomes like small little sticky bubbles, and when the heart is pumping, it travels to the brain vessels, and when the brain vessels are narrowed down, it goes and gets stuck into one of the small arteries, and the result of that is low blood supply to that part of the area. And when that part of the area has got less blood supply, the function that is controlled by that part of the brain is compromised. So that's why it's very important for us to recognize those early signs, the warning signs, and if possible intervene and prevent a disastrous or a major problem.
డాక్టర్ రేఖ గారు చెప్పినట్టు మెదడులో రక్తాన్ని సరఫరా చేసే రక్తనాళాల్లో కనుక క్లాట్లు ఏర్పడి అవి కనుక రక్త సరఫరాకి అడ్డుపడితే అవి స్ట్రోక్ వచ్చే అవకాశానికి దారితీస్తాయి. స్ట్రోక్ వచ్చే అవకాశాలు ఎవరిలో ఎక్కువగా ఉంటాయి అని చూస్తే శారీరక వ్యాయామం లేని ఒక జీవన శైలి, దీంతోపాటు ఉబకాయం, అలాగే అధిక రక్తపోటు, దీంతోపాటు స్మోకింగ్ బాగా అలవాటు ఉన్న వారిలో, అలాగే మద్యపానం సేవించే వారిలో, వీరిలో స్ట్రోక్ వచ్చే అవకాశాలు ఎక్కువగా ఉంటాయి. మరో మంచి అంశంతో మళ్ళీ కలుసుకుందాం. నమస్తే.